Let's talk about baby's position inside your uterus and how it can affect the outcome and the choices that you have to make throughout your birth experience. There are many different positions that your baby can be in inside your uterus because they're floating around in water and they like to move. It's important to remember that the position your baby is in is not permanent necessarily, and you can do something about it. So let's explore what positions we're talking about. The ideal position for your baby to be in is called Occiput Anterior. This means the baby is of course head down, but it also means that their face is facing your bottom. This allows for the baby's crown of their head to be pushing against your cervix fully, which allows for even and equal dilation of your cervix. A secondary ideal position is for baby to be in LOA, which is left occiput anterior. This is because babies naturally do a turn on their way out, and so they're sort of halfway there, just on the left side, and their head is still pressing correctly on the cervix. Being either in the LOA or OA positions means that baby is going to have an easier time doing the turn and coming out safely. Just like this. So when a baby is born, they are moving down through the vaginal canal. As they're coming out, they do a nice little turn to the left, and then they are coming up right directly onto your chest. There are, of course, less ideal positions, one of them being the occiput posterior, which means that baby is actually coming out the opposite way, or sunny side up. OP, or sunny side up, means that baby's head and spine are actually against your spine and tailbone, which makes labor a lot more difficult, and it is often pretty painful, causing something called back labor. The reason it's more difficult is because baby might have a harder time actually doing their turn, so they have to come out in alternative ways, which can make labor a little bit harder. It is of course possible to deliver a baby safely in either of these positions, but it just makes it a little bit harder, and so it's good to have guidance from a doula or your provider. Most babies are movable, so there are some positions you can get into with or without an epidural, such as forward leaning inversion, getting on your hands and knees. Anything that puts baby in like a hammock-like position is great. A side-lying release requires external support, but it is fantastic for opening up your pelvis. The throne position is also very helpful because it helps with blood pressure, positioning, and also gravity to help move your baby down. We are going to switch gears here and talk about malpositioned babies. The most common and severe malpositioned babies are usually either breech or transverse. When a baby is transverse, it means that they are actually stuck side to side. So even if they are tilted up a little bit or tilted down, that means they just don't have the space or the ability to actually turn head down. I would say that most pregnant people have heard the term breech, but did you actually know there are 4 ways that a baby can be breech? Frank breech is the most difficult type of breech to deliver vaginally if you were to, because their little feet are all the way up by their heads, leaving their bottom first. This can also cause some hip dysplasia issues. Complete breech is when baby's legs are actually folded inwards, like crisscross applesauce, all the way down by their bottom, and it's easier to grab a foot during delivery. Incomplete breech means the baby may have one leg down or up, and then the other one is crossed across their body like a little pretzel. Footling breech is actually very rare, and if it were to happen, it would be the safest and easiest vaginal birth with a breech baby, but it literally means that their legs are pointing straight down. So what options do you have if your baby is breech or transverse? Typically, the first option provided to you is a C-section, but it's important to know you do have other options as well. First and foremost, finding a provider who will be supportive of a vaginal breech birth. They are hard to find because it's actually not really taught in obstetric school anymore how to safely extract a breech baby, but they are out there. So if it's something you are interested in, finding that community to help you find that correct provider will be essential. Another option is called an external cephalic version, or an ECV. An ECV is where a provider takes manual pressure on the outside of your uterus to actually move the baby head down, and it's always done in a hospital setting. In a little bit more detail, this means that your doctor and either another nurse or another doctor would manually turn baby using kind of a counter pressure technique from either side to help turn the baby downward. There are, of course, risks to this procedure, 2 of the biggest ones being placental abruption or complications with baby. There's also a risk that the procedure could actually send you into labor, and then it would be a C-section if baby has not turned yet. In general, it is a safe procedure for someone who wants to try and avoid a C-section. It's of course really important to talk with your team and your provider about their success rate with an ECV, because it's actually not a procedure with very high success rates, and it's important to understand that your provider may not have the skill set to do so, and you would need to find someone who has a better outcome percentage with ECVs. And by that I mean, do they have a 40th percentile success rate, an 80th percentile success rate? You can look for someone else within their practice who might just be a better choice. There are also things you can do at home to try to turn your baby on your own accord that feel a little bit more natural for your body. My first at-home technique would be using spinning babies, specifically the 3 Sisters of Balance. This is something you can take a class in or simply just look it up online. Another great option is moxibustion, which is Chinese medicine that has been used for thousands of years. Moxibustion sticks contain a mugwort plant, which you would light and allow to smoke near the BL57 acupuncture point in your feet. This is actually in your toes, and in theory it works to encourage the baby to turn head down. You can also use positional methods such as the hot and cold compress, where you put cold on the top of your belly and hot on the warm to encourage baby to turn because they don't want to be cold. Or you can use music at the bottom of your belly, again, to have baby turn their head, and yeah, they just move head down. Obviously, it's not an exact science, but it is definitely an easy option to at least try. I will always recommend a Webster certified chiropractor or acupuncturist for someone who has a malpositioned baby, and of course anyone else as well. These techniques can help to open up your pelvis and realign it to help make room for baby to turn and move down more successfully. It is recommended with all of these techniques that you can do at home to do them earlier if possible. When baby has more space to move, such as in the more 33-34 week gestational age, this allows for baby to have more success in turning because they just have a lot more room than later on. And then of course there's the option to have an electrocesarean. Whether you decide right off the bat that you would prefer cesarean, or you go through the other measures and baby doesn't turn and you come to a cesarean as your choice, it is another great option to get your baby out safely. If you choose to have a cesarean, make sure you talk to your provider about family-friendly or gentle cesareans. What this means is making the situation and the surgery a little less medical, with options like holding your baby immediately, not having as many leads on your chest, potentially seeing baby come out, cutting the cord ceremoniously, vaginal seating, etc. Anything to help make your cesarean more comfortable for you.